If you're a dog owner, you've probably been there. There are a few key reasons you end up making that trip to the vet. And let's be honest, the dreaded ear infection is right at the top of the list. It is, without a doubt, one of the most common problems our furry best friends face, and it can be so uncomfortable for them. So let's dive in and really unpack what's going on inside those ears.
Right? The constant head shaking, maybe a little bit of whining, that scratching that just will not stop. If you've ever seen your dog doing this, your gut tells you something's not right. And you're right. This isn't just a minor itch. It's often the very first clue that an infection is starting to brew.
The signs can be pretty obvious once you know what to look for. That head shaking, that's your dog literally trying to get whatever's bothering them out of their ear. The scratching is a dead giveaway, of course, but also watch for them rubbing their head on the carpet or furniture. And then, oh boy, the smell. A foul, sometimes kind of yeasty odor is a huge red flag. If you look inside the ear, you might see that it's red, swollen, and has some discharge. Could be brown, yellow, or even a little bloody. And if your dog yelps or flinches when you go to pet their head, well, that's a sure sign of pain.
So it's really important to get this. An ear infection isn't just one simple thing. Vets will tell you it has a multifactorial origin, which is just a fancy way of saying there are usually a few different puzzle pieces that have to fall into place to create the perfect storm for an infection. Let's break down those pieces, shall we?
First up, we have what are called primary causes. I want you to think of these as the spark that lights the whole fire. These are the underlying issues that can cause inflammation in the ear all by themselves. The usual suspects here are allergies, both from food and the environment, but it could also be something like tiny ear mites or even a pesky grass seed that got stuck in there while you were playing fetch. Next, you've got your predisposing factors. Now, these don't actually start the infection, but they basically roll out the red carpet for it. We're talking about things like your dog's own body shape. You know, those adorable, long, floppy ears on a basset hound? Well, they're fantastic at trapping moisture. And speaking of moisture, if your dog's a big swimmer, that creates the perfect, warm, damp little environment for trouble to start. Even things like overcleaning can accidentally set the stage. And all of that brings us to these secondary causes. This is the part we actually call the infection, that gnarly overgrowth of bacteria or yeast. Now, here's the thing. These little microorganisms are normally in a healthy ear in small numbers. They only become a problem when those other factors create that perfect, inflamed, moist home for them to just multiply like crazy. They're total opportunists. They aren't the root of the problem. And finally, this is what we want to avoid. The perpetuating factors. This is what happens when an infection goes on for way too long or it just keeps coming back. The chronic inflammation actually starts to cause physical, permanent changes to the ear canal itself. It can get thick, narrow, even scarred. These changes make it almost impossible for medication to get down where it needs to, which just traps the infection deep inside and creates this awful, vicious cycle. Okay, this picture gives you a really clear, though I know, difficult look at what we're talking about. This is a severe case where that constant inflammation has caused what's called hyperplasia, basically a thickening and narrowing of the ear canal. Once an ear gets to this stage, it is a major challenge to treat. And that is exactly why catching and properly treating these things early is just so critical. Okay. So you've spotted the signs, you know it's time for the vet. Heading in for a diagnosis can feel a bit mysterious, right? But it's actually a very logical, step-by-step investigation to figure out exactly what's going on in there. It usually breaks down into 3 key parts. It's going to start with a simple visual exam, just looking and gently feeling the outside of the ear for any pain or swelling. Next, they'll use an otoscope, that special tool with a light and a magnifier, to get a good look deep inside the ear canal. They're checking the health of the canal and, really importantly, making sure the eardrum is still intact. And finally, and this part is crucial, they'll do a cytology. They'll just take a little swab of the gunk, put it on a slide, and look under a microscope to identify the specific culprits. Is it yeast, bacteria? Knowing what they're fighting is key. This slide gives you a perfect owner versus vet perspective. On the left, that's what you see, a red, painful, crusty-looking ear. But on the right, that's the view through the otoscope. This is what lets your vet see past all that and actually assess the inflammation, how much discharge there is, and the health of the eardrum way down at the bottom. It's an absolutely essential tool. All right, once the vet has a clear diagnosis, it's time to talk about the plan. And the goal here isn't just to clear up the current infection, it's also about managing whatever caused it in the first place so it doesn't just come right back in a few weeks. So your vet's plan is going to be tailored to your dog, but it usually includes a few core things. The hero of the story is typically a medicated eardrop, which is this great combo of an antibiotic, an antifungal, and a steroid to fight the bugs and bring down that painful swelling. Your vet might also do a really deep cleaning right there in the clinic to get things started on the right foot. If it's a really bad infection, oral antibiotics and pain relievers might be on the table. And most importantly, the plan has to address that primary cause we talked about, whether that means getting allergies under control or something else.
Because really, while treatment is great, prevention is everything. For any dog that's prone to ear infections, ongoing care is the absolute key to breaking that cycle of discomfort and constant vet visits. So let's talk about some best practices. Think of this as your cheat sheet for happy ears. You absolutely do want to check them at least once a week. Just get to know what a normal, healthy ear looks and smells like for your dog. Do use a proper vet-approved cleaner. And always, always, always gently dry their ears after a swim or a bath. Now for the don'ts, and these are huge. Do not use cotton swabs. They just pack all that debris further down. Never use harsh stuff like alcohol or peroxide. It can really irritate the skin. And believe it or not, don't overclean a healthy ear. But most importantly, don't ignore those first little signs. Because this is what it's all about, right? A dog that isn't in pain, that isn't miserable, that isn't constantly shaking its head. Being proactive and just paying attention to the little details, that's what keeps our dogs healthy, comfortable, and living their absolute best lives with us.
So, after going through all of this, from the complex causes to the different treatment plans, what do you think is the one thing, the single most important takeaway for preventing these miserable infections? It really truly boils down to this. A clean, dry environment is just a terrible place for yeast and bacteria to grow. By doing those simple, regular checks, you can catch any hint of moisture, any funny smell, or any redness way before it blows up into a full-blown, painful infection. It's those small, consistent habits that make the biggest difference in the world for your dog's health.